Are you a physical therapist who enjoys working with cash pay patients, maybe highly motivated, more active patients, but you don't know how to get more of those people on your schedule or how to keep them longer so you can enjoy being at work and working with the people you actually work with on a regular basis? If so, this video is perfect for you. My name is Dr. Garcia. I help cash-based physical therapists like yourself enjoy work, thrive in their clinical approach, and get more cash pay patients on their schedule. If you look at cash pay patients, you have to understand they've probably gone through the medical system, they've seen other medical providers, they've seen other physical therapists, and they've landed onto your schedule. You have this 1 to 2 sessions to try and figure out what it is that they're looking for. And the easy route for most physical therapists is to simply show your clinical skills and how your back mobilizations or your shoulder soft tissue treatment or your fancy exercise is that much better than everywhere else. However, you have to understand this person chose cash pay services for a reason. They didn't come for more exercises. They didn't come for more clinical skills. Someone clearly wasn't listening to them or understanding them in the medical model. So they probably have been to their physician. They've been to other providers that probably did the same thing that you're about to do. And the challenge with you is that you're likely trying something that you've learned in PT school or a traditional CEU course or your traditional insurance-based practice, and you're now trying to implement that onto a cash pay patient. And before you do that, before you move forward, I have a simple thing that you can be doing inside either initial evaluation or any follow-up treatment sessions. So before you dive into more clinical skills and you puff your chest and you show them why your initials, your OCS, your SCS, your certification that you just learned is the magical trick that's going to get this cash pay patient better. Now, here's a dilemma that a cash pay patient has that a clinical PT doesn't understand. First, the cash pay patient, because they've gone through the ringer with the medical model, they're looking for something different. And if you really think about this, they're looking for a different experience. They're looking for somebody who understands them, who gets them. And so you need to figure out that first before you figure out what you can do to the knee. So you have to figure out why they came in and what they're looking for. So take 2 questions and include them inside your framework. Number 1, what is it that they want to do? What is the destination? Not what the knee pain is, not what it bothers them with, not the stairs that it's blocking them from going up and down, not doing any of these things. What's the thing they want to get to? What's the thing that drove them in to come to see you? What's the frustration, the thing that brought them to your office? That's the destination. That's what they want to get. Now that might be, losing 10 pounds. And that's a destination they want. They want to be able to do that, but they can't because they're stuck with this knee pain that doesn't allow them to go to the gym. It doesn't allow them to do things, so they can't lose the weight. That is the ultimate goal. That's where they want to go. Now you have to figure out, okay, well, what have you tried in the past? Well, you've been to other providers. What didn't they do? Or what did they do that you didn't like? And then you figure out what they were missing. So if you figure out what the patient wants in terms of long-term goals, so you can help support that, and you figure out where they've been and what they haven't had done to them yet or was done incorrectly, those are the things to focus on. Now, if you have that destination and the things that went wrong in the past, this gap is where you serve the most with a cash pay patient. Now, the bigger the gap, which means the bigger the solution you can provide. If somebody just tried one provider and they didn't like their manual techniques, that's going to be an easy fix. Somebody who hasn't really gone through the medical system or anybody else, seen anybody else, or hasn't been that frustrated, that gap is very small. So there's not a lot of solution you can provide. So you have to figure out which patient, how big is their problem, so you can provide a great enough solution for them. But what you don't want to do is go straight into the clinical skills and prove why you're so much better. That's not what this person's looking for. So if you want more cash pay patients, you have to understand why they came to you, what they're looking for, and what worked and didn't work in the past. That is the solution to help you be successful without even changing or upgrading your clinical skills. So before you go into getting more CEUs, more credentials, so that you can prove to cash pay patients that you're that much better. But the reality is they don't care. They just need somebody to understand what they're going through, what they've been through, and where they want to go. That person can help you, that guide that patient to success. So on your next initial evaluation or follow-up treatment session, include these 2 questions. It'll make a difference and be a game changer for you to get more cash pay patients on your schedule so you can feel good about your job, improve outcomes, and thrive in your business. Enjoy.